Kathy Blake, and I've been a registered nurse for 36 years and have held many positions in healthcare administration, everything from a bedside nurse to the chief nursing officer during 25 years that I spent at University Hospitals of Cleveland. I've been with Summa Health just shy of 12 years and have held multiple positions during this time as well. Today, I serve as the Senior VP for our post-acute care division. And what falls underneath that umbrella is our partnerships and joint ventures with our post-acute care partners. That includes home care and hospice, inpatient rehab facility, a long-term acute care hospital relationship, our home infusion program, and our SNF collaborative. I also have oversight for integrated care management. So that's the acute hospital level care management, our ambulatory and accountable care organization care managers, and some enhanced care management programs. And lastly, I have oversight for our Complex Care Institute, which houses our geriatrics, palliative, and complex care clinical programs, our fellowships, and our research area. In addition, I've served as the president of our ACO, known as New Health Collaborative, for 2 years, from 2020 to 2022. So population health, value-based care, and vulnerable populations have been the primary focus of my work for over the past almost 12 years. So today I'm going to cover what is population health. So according to the CDC, population health is an interdisciplinary, customizable approach that utilizes non-traditional partnerships among different sectors of the community, public health, industry, academia, healthcare, local government entities, to achieve positive health outcomes. So to put it simply, population health is the study of health outcomes found in a group of individuals. It's often used as a way to determine the overall health of the community or a subset of the population. And it can be used to identify large-scale trends that you really should prompt further investigation on the needs of a particular community. So on one level, population health keeps an eye on the threats to the general public and health of the general public. Are there infectious outbreaks happening, such as the public health emergency and the COVID outbreak? How many people are smoking or struggling with obesity? And what's the average life expectancy of a particular group? But then on another level, population health takes us a little bit step further. Instead of just determining the average health of the people in a specific location, this approach also looks at health outcomes and issues by demographic or by other defined characteristics. For example, a population overall may have a comparatively low rate of a type of cancer, but under closer inspection, we may find that a specific ethnic group may have within a population has an elevated rate of cancer. Or maybe there's just a clear divide in health outcomes based on income levels and gender groups. So these findings can help spur further investigation and research into what's really the root of the difference so that we can better manage the population that we're trying to serve. So population health refers to that distribution of health outcomes within a population and then the health and social determinants that influence that distribution. So population health management is actually a model of care that addresses individuals' health needs at all points along the continuum of care. It includes the community setting, and it's through participation, engagement with patients, and some targeted interventions for a really defined population. The goal is to maintain or improve the physical and psychosocial well-being of individuals and to address their health disparities through cost-effective, innovative models of care. One of the primary goals of the Patient Protection Affordable Care Act, often referred to as the Affordable Care Act or the ACA to keep it short, is to support innovative medical care delivery models that are really designed for the lower cost of healthcare. And as an ACO, one model where payments are based on the health outcomes of populations being served, and it's not on the volume of service provided. So that ACO model is often referred to as a population health model. And it's inspired by the triple aim, which really is to improve the experience of care, to improve the health outcomes of the population, and reduce the per capita cost of healthcare. So healthcare directly impacts and is impacted by everything we do. So population health seeks to understand these connections between clinical and social needs. So that brings me to just a minute or two here on social determinants of health, or what is commonly known as SDOH. These are the conditions in the environment where people are born, live, learn, work, play, worship, and age, and that affect a wide range of health and functioning and quality of life for people. So your zip code does matter. Where you live matters. Your education matters. Your access to care matters. Social determinants of health include socioeconomic status, education, the neighborhood you live in, the physical environment of the neighborhood, your ability to find employment, social supports that are within your community. So addressing those social determinants of health is important for improving health and reducing longstanding disparities in healthcare. So one of the things that we do a lot here at SUMA with my care teams is to focus on helping to identify social determinants of health. So we had a patient here that was thought to be non-compliant or non-adherent to the treatment plan as she was not taking her prescribed medications. So at SUMA, we do have care managers and social workers who are embedded in our practices to help when patients have potential social determinants that might be barriers to allowing them to obtain their prescribed medications. We work as an interdisciplinary team. So we have nurses and care managers and social workers and providers and pharmacists who join our discussions around what might be going on for a patient. In this particular case, where the patient was considered to be non-compliant, as we began to have further discussion, engage with that patient around what might be going on for that person, what might be challenges. And what we learned was that this patient had two issues. One, the financial ability to afford the medication, and then transportation or the lack thereof to be able to go and pick up the medication. So after having some conversation with the provider, we were actually able to change the medication to something that was a little more cost effective, but would still cover the treatment plan. And then we also looked at getting DocuDose for this patient, which would allow through her health plan for the pharmacy to send the medications directly to her home. So that solved some challenges, got this patient back on track who was taking her medications. So how do you make population health part of your work, part of what you do every day? So I'll leave you with a couple of final thoughts on population health and social determinants of health in terms of how I believe it could be most effective in how you would work with patients around these two components. It's understanding the importance of incorporating healthcare promotion and prevention into the day-to-day patient management. I think that's huge. We're always going to have patients who have complications and comorbidities, but getting ahead of it is certainly the ideal way to interact with patients. Use of evidence-based models with clinical care guidelines readily accessible at the point of care is also essential for the care team. Another thing is to know and understand your role as a provider on that interdisciplinary team and to value the voice of other disciplines, because it does take a village to manage and care for some of our populations, and every discipline brings valuable information and insights. Document well in the EMR because it's a source of data that helps us understand the needs of the population we serve, and listen well and observe well because those are skills that will certainly help you in assessing social determinants of health and real needs for the patients we serve. Thank you.